Hi everyone, welcome back. Today's topic, coronary artery disease, or CAD, the leading cause of heart-related deaths. CAD is a must-know for the NCLEX and patient care, as it involves atherosclerosis narrowing the heart's arteries, causing symptoms like angina. We'll break it down using the ADPIE framework: assessment, diagnosis, planning, implementation, and evaluation to make it crystal clear. Plus, we'll wrap up with NCLEX tips to help you ace those tricky questions. Let's get started. First up, assessment. As nurses, we're looking for signs of myocardial ischemia, like angina, chest pain, or pressure, often radiating to the left arm, jaw, or neck. For example, imagine a 55-year-old patient, John, reporting a heavy, squeezing sensation in his chest after climbing stairs. Women may present differently, with symptoms like fatigue, nausea, or shortness of breath. Key to note for NCLEX: we assess vital signs, oxygen saturation, and order a 12-lead ECG to spot ischemia. Don't forget to check risk factors, modifiable ones like smoking, hypertension, or diabetes, and non-modifiable ones like age or family history. Lab tests: think fasting glucose, lipid panel, and high-sensitivity C-reactive protein to gauge inflammation. Moving to diagnosis. Based on our assessment, we might identify nursing diagnoses like acute pain due to myocardial ischemia or ineffective tissue perfusion from reduced coronary blood flow. For John, his chest pain and elevated LDL cholesterol point to CAD. Key causes include atherosclerosis, where LDL cholesterol triggers inflammation, forming plaques in arteries. Risk factors like diabetes, fasting glucose over 126 mg/deciliter, or hypertension, systolic BP over 140 millimeters of mercury, drive this process. Women, especially post-menopause, face higher risks, so consider their unique profiles. NCLEX tip: always link symptoms to underlying pathophysiology, like plaque rupture causing unstable angina. Now, let's plan. Our goals are patient-centered: relieve chest pain, improve tissue perfusion, and reduce risk factors. For John, we aim to keep his oxygen saturation above 90%, reduce his LDL below 100 mg/deciliter, and help him quit smoking. We prioritize lifestyle changes, like a low-fat, high-fiber diet, and medications like statins for hyperlipidemia. For women, we emphasize managing hypertension and diabetes, as these are stronger risk factors. Our plan includes patient education on recognizing angina and when to call 911, crucial for preventing acute myocardial infarction. Time for implementation. We start with oxygen therapy to maintain saturation above 90%, especially if John's hypoxic. Administer sublingual nitroglycerin for angina, up to 3 doses, 5 minutes apart, and monitor for hypotension. Aspirin, chewed at 162 to 325 mg, is a lifesaver for acute chest pain. We also give morphine for pain relief, watching for respiratory depression. Long-term, we educate John on lifestyle changes: quitting smoking, exercising 30 minutes most days, and following a DASH diet. For women, we stress early symptom recognition, as they often delay seeking care. Referrals to cardiac rehab are key for sustained recovery. Finally, evaluation. We check if our interventions worked. Is John's chest pain gone after nitroglycerin? Has his ECG returned to baseline? Are his lipid levels trending down with statins? We monitor vital signs, oxygen saturation, and lab results like LDL and hsCRP. For long-term success, we confirm John's adherence to lifestyle changes, like smoking cessation or weight loss. For women, we ensure they understand atypical symptoms to prevent delays in future care. If goals aren't met, we reassess and adjust the plan, maybe tweak medications or intensify education. Let's nail those NCLEX questions. Hint: if a question describes chest pain unrelieved by rest or nitroglycerin, think unstable angina or MI, call 911. Prioritize ABCs: airway, breathing, circulation. For example, if a patient has chest pain and low oxygen saturation, administer oxygen first. Watch for women's atypical symptoms, like nausea or fatigue. Sample question: a patient reports chest pressure after exertion, relieved by rest. What's the likely diagnosis? Answer: stable angina. Know your lab values. LDL goal is under 100 mg per deciliter, and hsCRP over 3 mg per liter signals high CAD risk. That's a wrap on CAD and ADPIE. You're now ready to tackle this topic on the NCLEX or in clinical practice. Hit that like button, share with your study group, and let me know in the comments what topics you want next. Keep studying, future nurses. You've got this.